Well, depending on where you're from, we wish you a good morning or a good afternoon, and welcome to the Facility Compliance Think Tank presented by Soleran. My name is Mike Foley. I'm the Vice President of Strategy and Business Development here at Soleran and a moderator for today's call. This is the second webinar in our spring three-part series. Today's topic, it's a great one. It's the importance of EC tours in efficiently closing the loop. So our webinars really have two purposes. The first is we want to discuss best practices in the areas of facilities, life safety, emergency preparedness and security, and other compliance-related topics. But secondarily, we want these series of webinars was created really to help healthcare professionals network and connect and share ideas and best practices. So let's introduce our panelists for today's webinar. Let's start with John Boyer. John Boyer is the Director of Environmental Affairs at Brigham and Women's Hospital. He's a published scientist with over 14 years of experience in the management, application, and research of safety, health, and programs in healthcare. He has specialties in industrial hygiene, human factor, ergonomics, exposure assessment, occupational epidemiology, and behavioral health. He's also a risk manager of environmental health and safety at Boston Children's Hospital. He spent 2 years at Liberty Mutual Research Institute for Safety in the Center of Physical Ergonomics. He's also the research coordinator at the Center for Promotion of Health in the New England Workplace, CPH-NEW. And then we have Tony VanDyke. He's the Director of Environmental Health and Safety at Thomas Jefferson University. He was a fire marshal for over 6 years, adjunct professor of fire sciences at Montgomery County Community College, part-time as a hazardous material technician battalion chief for Montgomery County. He also served as an adjunct professor in the Public Safety and Environmental Protection Institute for 17 years at St. Joseph's University. Spent 4 years as a fire and life safety engineer at Ewing Cole, a life safety engineer at RDLA Architects and Engineers. Tony has his bachelor's and master's degree from St. Joseph University, and he started his career at the Children's Hospital of Philadelphia as a safety specialist and then a senior safety specialist. And finally, we have Lance Woolf. He's the Director of Life Safety and Compliance here at Soleran. He's a former life safety code surveyor with the Joint Commission. He spent 17 years in hospitals at the director and senior director level. And during that time, he oversaw engineering, emergency preparedness, safety, biomed, security, and environmental services. We greatly appreciate all of our speakers for taking time on their very busy schedules to provide us with their in-depth knowledge on this topic. This should be really good for everyone, and we greatly appreciate them being here today. So just a couple of housekeeping items. Each panelist is going to have roughly 10 to 15 minutes utilizing PowerPoint slides to talk about their topics. We just encourage you to take screenshots if you would like. There's a lot of great information you're going to see today, but also feel free to use this webinar as a reference. After our speakers have presented for their 10 to 15 minutes, we're going to have a live Q&A session. Please use the Q&A button at the bottom of your screen to ask your questions. If your toolbar disappears, just scroll your mouse over it and it should reappear. One of the last slides of the presentation will have more information about the Facility Compliance Think Tank so you can utilize the FCTT's community network in the future, and as well as get in touch with Soleran after this presentation. So let's get started with the webinar. John is going to kick it off. He's going to talk about why their organization decided to transition to digital rounding, as well as to keep doing them. He will also speak to what the transition to the digital rounding was like for their facility. John, take it away.
Well, good day, everyone, and thanks, Mike. It's really great to be here with this great panel and with all of you. I'd like to start by just also thanking Mr. Peter Massey, who was a contributor to the slides today and has spearheaded a lot of the work that I'll share today. Next slide. So, of course, if you're going to implement environment of care rounding in the digital realm, you first have to decide that it's important. And so I'm lucky enough today to have the task of explaining to you and sharing some of the details of why we at our hospital system decided that it was important, and how we implemented the early stages of it, what some of the details and trials and tribulations were like, going from manual or non-digital to digital methods. And then I'll talk about some of the roadblocks that really are the reality of any type of transition of that scale in a large healthcare system. Next slide. So our goals in our system, I think like most of you, for any kind of environment of care rounding or hazard rounds, whatever you might want to call them, we're really to find and fix safety and health and environment of care issues at regular intervals. You need to know what your hazards are out there in order to fix them. We wanted to really consolidate our rounding from multiple groups. We had heard from some of our internal stakeholders that there's just too many rounds going on. Infection control has their rounds. Leadership has their rounds. Environmental health and safety has their rounds, and on and on. And so we heard that from our internal customers, and it also was an efficiency barrier for us. So that was one of the important goals. Providing opportunity for collaborative learning and problem solving among the frontline staff and EC leaders. This is really critical. I think any of us that are in the health and safety and compliance field know that it's hard in our busy schedules to kind of get out and get face time with our internal stakeholders, and to really have an opportunity to kind of identify and talk with them about what their problems are and share with them why it's important to correct them. And then, of course, we wanted to satisfy CMS and Joint Commission and other regulatory compliance requirements around environment of care rounding and what can be found in this process. And I know Tony and others will talk about this later. And then finally, this may be one of the most powerful ones. We wanted to collect and track ECG issues in a standardized manner to help prioritize and sustain organizational risk management. When you're doing this in multiple realms with multiple groups and paper and pencil methodologies, and then you need to kind of consolidate all that data and figure out how to analyze it, prioritize it, and then present it for change, it's really not efficient in a manual method. So that's really the why for us. Next slide. So what did our process look like? What did the transition look like? For any type of large transition, again, for a large healthcare system like us, we're 800 plus bed academic teaching hospital located in Boston. We have 18 buildings across 8 different campuses, 600 plus standardized, we created 600 plus standardized EC, LS, and IC questions. And so with that scope and scale of work, you need a dream team. And so the groups there shown in the little stick figures are our key subject matter experts that we all had to get buy-in first on this process. And then we also, once we did that, we needed to ensure that in this realm of IS security risk, that we did our internal system-wide IT risk assessment. And that process in and of itself, just before you get to the flow diagram on the slide, was really over a year. And then once we completed the risk assessment for IT, we got all of the folks on board, then the process there of establishing contacts, building facility trees, scheduling rounds, conducting the surveys, doing debriefs from the surveys, and then the corrective actions themselves and tracking those to completion. That's really the process of kind of start to finish at a very high level of the whole plan, do, check, act loop for us. Next slide. So this is kind of the mountain climbing journey that we went through. Really, when I started in my role here in this facility was in 2018. I realized that we weren't where we needed to be in terms of our rounding processes. We needed to go electronic. We finally did the things in the prior slide. We were able to implement and pilot in 2019. And then, of course, this little thing called COVID hit us, and that really slowed us down. But nonetheless, we were able to collect 250 surveys that year. And then as we, had waves came and went, we really ramped up. And last year, we were able to over double that to 539 surveys across all of our facilities. And that generated 1,622 total deficiencies. And we were actually able to show, tell me how many of you can do this in a large system like us, that 90% of our deficiencies were resolved in a year's time. And we would not have been able to do that without an electronic system. Next slide. And then just gives you a little bit of a breakdown of the types of rounds we're doing. I mentioned earlier, we have over 600 content questions, all linked to Joint Commission standards. And so we have environmental health and safety rounds, infection control, biomed, clinical compliance, and you can see the others there. And then we also have specialized rounds that are captured to a certain extent in our joint rounds, but we also, in my team, do targeted rounds that are more in depth with our electronic tool. Next slide. And then this is a dashboard, a very high level compliance dashboard from all of those rounds that we did in the calendar year of 2021 that I can then use to take up to my leadership to say, to answer the question that I'm sure all of us get, you get it too, how are you doing in the environment of care compliance? And so you can see along the middle row there, we have 86% of total compliance. That's simply a dichotomous measure for every single question we have. Did the observation meet the standard or not when we were there to observe it? Now we can show how many open deficiencies we had, how many we closed in a certain period of time, and then where we left off at the end of the year. And then at the bottom, you can see by different service areas, inpatient, ambulatory, clinical labs, and paraprocedural areas, what their compliance was that rolled up into the total EC compliance. Very valuable, critical, something you cannot do with paper and pencil very easily. Next slide. So these are just a breakdown of really our top 10. So if you want to then start to prioritize and risk manage and dedicate resources, each of our questions is assigned or linked to EC standards or LS standards or IS standards for that matter in our system. And so then you can see the breakdown there of what our top 10 were in 2021. And if you implement something similar, you could do the same thing. Next slide. So once we made it through reaching the end of 2021, we said, okay, we've done a lot of things, and how can we become better? So we decided that we needed to kind of standardize our corrective action process based on survey questions found to be deficient. We were able to link questions to Joint Commission standards, as I mentioned. We updated our campus directory site tree to include more ambulatory and support service locations. So essentially, now we're scaling out to other more distant locations. We activated our automated follow-up and past due escalation emails because we learned that we weren't getting the response that we needed from our frontline environment of care partners. And then we also focused training for our area managers, who again are our frontline partners, to make sure that they understood how to use the system, they understood how to do the corrective actions, and really to make the system more efficient. And then, as I mentioned earlier, we added 5 more ambulatory offsite locations to our survey schedule. Next slide. And so we also, in preparation for this year, we surveyed all of our area managers and subject matter experts to say, okay, how's it going? What are our goals? So we wanted to find out what days of the week and the frequency for determining routine EOC tours was. Any of you who do this, whether it's electronic or not, know that one of the most difficult things about doing this is the scheduling. That's what will trip you up in many cases, and that was the same for us. We wanted to kind of gauge interest or remaining interest in the program and beef that up where it was waning. We wanted to use survey response results to create a yearly standing EOC tour schedule, which we have done. And we wanted to get feedback from key users on areas in need of improvement. Next slide. So our results were, briefly, that we had a 100% response rate among our area managers and our subject matter experts that were surveyed, which is a good indication of participation. 100% of our area managers were interested in continuing the process, but the SMEs were struggling with the resource constraints and difficulty in dedicating that amount of time that we had suggested for weekly rounds that are really needed. And so ultimately, we with all the feedback, we decided that we were going to conduct 50 weekly rounds for 33 hours to visit each healthcare occupancy it looks like I missed a sentence there, but in order to visit each occupancy at least 2 times a year, which was the previous Joint Commission requirement, as a little promo for someone who's coming up next. Our goals were to be 95% compliant with SME participation and to have total yearly EC compliance of 95%. And we wanted to have all of our deficiencies corrected by January 31st of 2023. And finally, we want to integrate rounding software with our facilities work order system and then develop goals based on that, because that is one of our biggest remaining barriers. Next slide. So that's really the end of my presentation. I know I kind of sped through it at the end there because I wanted to make sure that we left enough time for our other presenters that are coming. And I think that there might also be some questions that the group has.
John, hey, we greatly appreciate you joining today, and that's a great presentation. Now we're going to turn our attention over to Tony, and he's going to speak to us about how keeping rounds has helped their organization, how it created efficiencies, and the importance of them, even though they're not required. Tony, we're really glad to have you here.
Good afternoon, everyone. Thanks for participating, and thanks, Mike. I appreciate it. And John, great presentation. Next slide, please. So we have to look at this. You know, John talked about how they made the transition going from making the decision to go from paper rounding and continuing a rounding program, even though it's not required for hospitals to do that anymore. What I want to talk about is the efficiencies that we found as an organization that's been doing this for about 5 years. And I do have to say, my staff has implemented this and done a great job, and they've been a big help in understanding these efficiencies. So the time of paper rounding is very, it goes back. It was required by Joint Commission. We were sending people out with checklists. And then what basically has to happen is you have to take that checklist and make it into something that you can share. You can share with a nurse manager, you can share with your leadership, and you can glean your information off of that. Well, when you're going out taking notes, you're doing exactly that. You're taking notes on a checklist of what you find. I do have to say, when I arrived at Jefferson, one of our older staff members was still using a typewriter to create the reports. So he was converting from a handwritten note to a typewriter, and then we still had to get that to a point where we could share that. So then we have to get the report to the proper staff. We had to scan it, we had to PDF it, and then we had to email it. So we basically had a chain email of who gets the report and where it goes. And in some cases, because we know of how much email we get, we're crossing our fingers and hoping that somebody opens that and reads that report and then can get their information out of the report that they need for their department. And then there's the issue, and John talked about it a little bit, is the creating the work orders, the facilities for facility repair, excuse me. And then what's even more difficult than creating the work orders is following up on the work orders. Basically, is something completed and is it not completed? And how do you figure that out? One of the issues we also always found with the paper rounding is there's no picture. If there's no picture, a picture creates, just creates a huge, it's worth 1,000 words, as they say. So if there's a picture attached to the deficiency, somebody can look at that and say, oh, that's what they're talking about, if they can't understand what we're saying. Next slide, please. Here's our form that we used at Jefferson. It's a legacy. It actually has our old logo on it. But this was a 2-page form checklist that was filled out. And basically, you walked through that checklist and you sort of worked your way through it. And then, like I said, you wrote in the comments and you had to convert it to something that could be shared across your organization. Next slide, please. So one of the things that we found was the tracking. The the following up on the tracking and deficiencies. And I have to say, I have a person in my office who spent a lot of time on this and did a really great job. But it was a time sink for them. Basically, they had to use a paper spreadsheet or a Excel spreadsheet. You had to look at the deficiency. You had to look at who the responsible party was. You had to look at when it was due. Was it due in 7 days? Was it due in 10 days? Was it due in 14 days? And then that person also had to look at, and this is why it became time consuming, was when do reminders go out? When do you remind a person, hey, we haven't heard from you, it's been 7 days or it's been 10 days. And then the next part of that, which becomes even more difficult, is the escalation. So these are all individual emails going out to individual people that basically somebody in my office was following up, specifically following that chart across. And then what do you do if you get no response from those people? How far do you escalate it? The CEO of your organization doesn't want to know about a nurse manager who is not following up on EOC tours, but you want to make sure there's an escalation so that you are getting that follow-up, so that you're figuring that out. Next slide, please. So converting to digital based rounding. So you have to know what the process is, okay? Basically, you're going and you're taking a digital device, whether it's a phone, whether it's a tablet, whether it's an iPad, and what you'll find with your staff is they'll determine what they want to use. Those of us who are older and are wearing glasses, give me the biggest thing I can to type on. But I have people who will go out with a phone and they're happy as can be. So you're going to use your digital device to capture deficiency in the format that you developed with the vendor. Soleran was our vendor, and we worked pretty closely with them. Okay. What you're going to do is you're going to take notes and you're going to look for key locations. You're going to put in room numbers. Room numbers are key because especially for work orders to getting a facilities person there. Your notes don't have to be perfect. So you can basically put your notes in, say what you found, keep moving. Get a picture. The picture is not only good for the person who's going to receive your report, but that picture is going to be good for you because if you come back in a day later to look at it, you read your notes, you read your own hieroglyphics, but you look at the picture and goes, oh, that's what it was. That's what I was looking at. Then you're going to go back to your desktop and you're going to clean up your rounds. You're going to make them presentable so that you can send them out. You're going to send them out and everyone understands them. You're going to make sure your deficiency is identifiable. Where does it go? Where are you putting that? Is it in the right place? Making sure that when you send it out, somebody knows exactly where it is. Another key is if you're using a work order system, that work order system might have to glean that information directly from your rounding software and from your rounding report. So make sure that that right information is in there, okay? Here's the key. It's a 3-step process. Once you get to C and you hit complete, those rounds go out, those reports go out, and that connection to your work order system goes out. Next slide, please. Okay, so the key is the front end work. And this is where it might take you a little bit of time on the front end. And I know John just went through this. We went through this 5 years ago. And as we're adding new hospitals on, we're going through it at the same time. But you want to know what's going to happen. So that front end work is making sure the right units are in, the right locations are in, everything's in there that hooks to your work order system. Making sure that your right follow-ups there so that when the report is sent, it's sent to the right person. And then how are you notified on the follow-up? How are you notified when the correction plan is put in place or an action plan has been put in place, or when that deficiency has been closed by that responsible party? How is the escalation of the deficiencies set up? Do you know exactly how that's set up? Working with your vendor to know in 7 days it's going to go to the responsible party. In 10 days it's going to be a reminder to the responsible party. In 14 days it's going to be escalated to that person's manager or that person's vice president. Make sure you know that. But those are, if that's happening automatically, then you take that person sending an email out of that, okay? So you want to make sure all those notifications are in place on the front end, and that's where you're going to pick up your efficiencies on the back end of not having somebody sending out emails, of going through spreadsheets looking for are things completed. Next slide, please. Okay. Where's the time saved? One, it makes your report presentable. Okay. With the digital rounds, that's creating the report based on what you put in on the front end and then what you find during your rounds and in your cleanup. Secondly, you're not creating work orders for deficiencies. It's happening automatically, and you're not having to track when work orders are completed, because that's happened automatically as long as you have that interface between your work order system and your digital rounding system. Making sure you have those automatic reminders, so you don't have a person sitting at a computer all day sending out reminders that, hey, we haven't heard from you. These deficiencies are still open. These work orders are still open. The automatic escalation is key, because the last thing somebody wants is their boss to be notified that they have these open deficiencies sitting out there. Now, there are some people who will not, you may not hear from. You may have to send those emails, but your efficiency of not having to do that constantly is key. And then having the automated process of closing out deficiencies and findings in the report. And like John said, when you have that dashboard that tells you how many deficiencies you had, how many deficiencies are closed, your whole process, that's key. And that's being able to show that to your leadership of exactly what you're doing. Next slide, please. So that's it for me. I hope that is helpful information that can help you make the decision and where you can find your efficiencies, your work efficiencies. Again, I like to thank my staff because they've done a great job implementing it and the time they've taken, and hopefully it's saved them the time on the front end and the back end. Okay, I believe I'm handing off to Mike. Back to Mike.
Tony, hey, that was great. And I tell you what, today we've had some great content. Tony, thank you for being a part of it today and really giving us your perspective from your organization and what you've seen work for you. Now we're going to head over to Lance, and he's going to give us the perspective from the Joint Commission Surveyor aspect on the importance of the environmental care tours and efficiency. Lance, thanks for joining us today.
Great. Yeah, thanks for having me today, Mike. I really appreciate it, and thank you for the introduction. So we're going to talk about the importance of EC's tours, specifically with a surveyor's perspective today. I got about 5 slides we're going to go through real quick, and then we'll do some questions afterwards at the end of this. So next slide, please. So let's talk about the environmental care tours history. And this is, as both John and Tony have talked about, this was a requirement with Joint Commission, and it was an annual, biannual requirement in every department that came under the hospital's license. So biannually, it had to be done in clinical, and annually, it was in non-clinical. Well, Joint Commission realized that many facilities throughout the United States were doing way more than that. And so in 2017, they decided to go ahead and delete the rounding standard completely. So they took it out of the comprehensive standards manual book, and then they left it specifically up to the organization's discretion. Next slide, please. So the question is, and once it was deleted, why should we do tours? Well, just because the tours were deleted, the EC standard was deleted, didn't mean that EC tours weren't important. Because having an active program is proven to help limit the low-hanging fruit, and that's found in hospitals every day. So it also allows you to educate your staff during your rounding process, and it helps identify trends, and it helps you also, when you're identifying those trends, implement mitigation strategies. For example, if you have biomed stickers that aren't being checked and you're going around and doing your rounding, you're realizing that staff aren't checking them before they're utilizing the equipment. That helps you right there to identify that trend, and you can start implementing a mitigation strategy. It also reiterates the importance of daily compliance with staff, and then the increase in rounding directly correlates with less findings, and I'll talk about that here on another slide coming up. Next slide, please. So some of the things that I've seen Well, it was very evident when I was up on the floors with facilities that discontinued their rounding program. You get up onto the floors, I would walk 15, 20 feet and already start identifying findings. And when we'd start having a discussion about their EC tours, they would tell them, well, that standard is no longer in existence. So we stopped our EC rounding program. But facilities that were active and kept the EOC tours going, which is the recommendation, they minimized their findings to about 9 findings. That was about the average. And for many of you within the hospital industry know, the majority of your reports, when Joint Commission comes in and surveys, the majority of the report comes from the physical environment. And the average is 21.5. That was back in 2021 was 21.5 findings per surveyor. So if you're hitting 9 findings, you're doing very well. But like I said, facilities that didn't, the low-hanging fruit was found everywhere. When I talk about low-hanging fruit, these are some of the examples, is you have blocked fire extinguishers, blocked med gas valves, doors are wedged open, or you had the tape in the slot where staff would put the tape across the latch, because they didn't want to punch the code in or utilize the key. And then also you had fire alarm pull stations are blocked. That's another example. But all these examples here are easily fixable. And when you're doing your EOC rounds and you're actively educating staff and staying up on the compliance, all these disappear. And these are all findings that would be up on the floors if you didn't have an active EOC program. Next slide, please. So here's some of the recommendations. One is continue rounding based upon your facility's needs, and that's where you determine that as an organization. Both Tony and John talked about that with their organizations on what they decided would be effective for their facilities. And you're going to want to do the same thing for yours. But when you start your program, you're going to want to do a ramp up time period. And this is my recommendation is it's either 6 months, 8 months, where you're doing more tours than what you're going to decide on, the final number, but do a ramp up period when you're and increase those tours, because you want to get an accurate overview of your compliance. You want to start identifying trends immediately, and you want to have that report card that you're able to look back at and see exactly where your compliance is throughout your facility. You're going to want to become involved in your clinical safety fairs if you have them. And the reason why you want to get involved in your clinical safety fairs is when your clinical staff comes around, that gives you the ability to educate them one-on-one on low-hanging fruit, and it helps them, realize, how important compliance is specifically with the physical environment. If you don't have a clinical safety fair, I've seen other facilities that actually have started safety fairs, or they've had EOC day. So there's other ways to approach that if you don't have that. Also, take staff with you, and this is clinical and non-clinical, take staff with you to help identify findings. So go through, educate them, and then take them into areas to where they start identifying findings for you. So it increases their knowledge, it helps with the education aspect, and then it also reiterates, when you're gone and they're up on the floors, they're going to keep looking for those findings. Next slide, please. So this is the last slide, and we're going to talk about some strategies. And this one, I cannot talk. You heard me talk, John talk about it. You heard Tony talk about it. Is you cannot educate. You cannot educate enough on this. And that's where, and the reason why you're doing it is because that education correlates with less findings. So you're going to want to purchase a software that's specifically related to rounding, but make sure it's customizable to your organization's needs, and make sure it's also efficient. If you're utilizing a software or technology that's not efficient, it's intrusive into your workday, and it's not going to be effective, and it's not going to give you that accurate picture that you need. So make sure it's customizable, make sure it focuses on those trends, because when you're identifying those trends, what are you looking for? You're looking, once you find the trend, you want to make sure you're now working on your mitigation strategies. Also, approach the process as a positive. Don't approach it as punitive, and I've seen this happen where EOC rounds were looked at as punitive. So when they came up on the floors, staff didn't get involved, and some staff would say, when we saw EOC rounds come up, we'd leave. We'd go to lunch. I'd find a reason to go down the supply chain to pick up something, because it was punitive and it was treated as punitive. So make sure that you make that this is a positive aspect of when you're up on the floors. It's to educate, it's for their knowledge, and it's to help them as well, and to help the facility as well, obviously. And then the last strategy is utilize, when you're speaking with staff, I recommend utilizing examples that they can relate to. And one area that I've seen utilized, and I used to utilize this as well, is use a personal aspect of it. So if you find a blocked fire extinguisher, utilize that, as their home, say, when you're talking about a blocked fire extinguisher, utilize it in a personal manner where, yeah, I understand, and like when you're at home, I'm sure your the fire extinguisher you have, it's open, you have able to get access to it, and, use that personal aspect to where they start relating it to other areas and not specifically just the work environment. Well, that's all I have. And we'll get back to you, Mike.
Fantastic, Lance. And hey, I greatly appreciate your insights. That's a great presentation. Well, we have questions starting to come in, and I'm sure that we'll have a few more. So just as a reminder, you have the Q&A button at the bottom right of your screen. If it's disappeared, just hover your mouse over it, it should come back. And that's where you want to ask your questions. So at this point, just to give us a little bit of time, we're going to sort through those questions, and we shall be back right after this.
Hi, everyone. This is Grady with Soleran. I just wanted to pop in and say thanks so much for attending today's webinar, and I wanted to briefly introduce you to Soleran and ICM. Soleran has been developing software solutions since 2004. We've dedicated ourselves to developing an intuitive set of solutions specifically for healthcare facilities. We've also developed the market's only true ICM platform. ICM stands for Integrated Compliance Management. So what is integrated compliance management? Well, ICMs are generally comprised of multiple solutions designed to work seamlessly together within one platform. There's literally hundreds of systems and processes across multiple departments used to manage healthcare facilities. ICM is simply taking all of those solutions across all departments and putting them into one integrated platform. Having all your data in one place allows the system to automate many of your daily tasks, gaining better visibility, trending, and analytics. It actually does work for you. Soleran's ICM consists of 6 individual suites that include work orders, rounding, permitting, vendor management, project management, and security management. Each ICM suite consists of 4 to 8 different applications that can be used individually, but you'll see the most benefit when it's used as part of the entire suite. Of course, ICM's unique advantage is using multiple suites across the entire platform. Bringing this information together in one place across all departments gives you better visibility than what you've ever been able to achieve before across the entire hospital or even across the entire healthcare system. When your data starts working together across an ICM platform, you'll be able to visualize your data using new tools like the Compliance Survey Dashboard or the fully integrated Life Safety Drawing Manager. I know I went through this really quick and at a really high level, but we just wanted to introduce you to Soleran, ICM, and the tools that will ensure you're ready for your next survey. If you'd like to learn more, contact us at soleran.com anytime. We really appreciate you attending the webinar today and hope it's informative and useful for you to manage your facility better. Mike, back to you.
All right, Grady. And hey, we are back. And if we can have all of our panelists just turn their videos back on, that would be fantastic. So this has been a great webinar and some really good questions starting to come in. So let's do this. I'll start looking through a few of these. And I guess, Tony, let's start with you. So you spoke about how much time that you saved going to a digital format. Did you receive much resistance from staff when you were going through that transition?
In the beginning, yes. There were certain staff who wanted nothing to do with it. There was certain leadership that didn't want anything to do with it. They were very comfortable with receiving a piece of paper. I think in some cases they were afraid what we would find. Staff, yes, because it was new and different. You're always going to have this is the way we've always done it, which is something a phrase that I hate. But you will have some staff, we did have some staff push back. But I think you need leadership to be able to say, we want to move into the digital age and we want to be able to do this in a way that we're not having a staff member sitting there sending emails all day on one report. So it took time. I think we're still, as we're bringing new hospitals on within our system, We are getting some people who are pushing back, and we're just trying to sell them on what we're trying to do and why we're doing it.
Yeah, that's really good insight, and it's always interesting. Change is hard, and you've heard it said that folks change when the pain of being in the current state actually exceeds that of the actual change. So
Right.
I think that's absolutely true. So, and that's really good insight. Did anyone have a comment on that question, John or Lance? I didn't know if you guys had any thoughts about that as you were transitioning to more of a digital. Did you receive much resistance on that?
Hi, everyone. Yeah, this is John. I think Tony's absolutely right. Certainly, whenever you said it well, Mike, whenever there's change is hard. And especially when it's a large organization, it's multiplied by the number of divisions, leaders, employees that you have, and the duration of time that you've had the old system in place. So we definitely experienced that, but that's something to be overcome. And you just need to kind of work hard to get buy-in and you need to identify where kind of the barriers might be and work hard to explain to them what the value of the change is. And if you can do that successfully, then you're going to get there, in my opinion.
Right. Yeah, totally agree with that. John, let's stay with you for a second. So we had a question come in. Can you give an example of the IT issues that you had, and do you have any suggestions on how to overcome them for someone who's looking to transition to digital?
Yeah, great question. I mean, I think, we say challenges, some say barriers. I would say, at the point where you've decided that this is an important thing to do, and hopefully our presentations today have helped to convince you that this is the way to go, then I would call these necessary requirements. You just have to face them. And I would say the first one really is to understand when you're kind of at the early stages, once you've gotten buy-in, once you've gotten your IT kind of system in place, that implementation is a big lift. You just have to face it. If you're in a large organization, the department, often it's the safety department, sometimes it's the facilities department, where these compliance things live. You need to understand that your staff is actually going to need to invest a significant amount of time to get to the next level. It's like any important improvement project, right? So you should face it as an improvement project, and the things that take time is some of the things that I mentioned in my presentation. You have to establish who your contact lists are. Who are your EC leaders? Who are your frontline folks? Because those are the folks that are going to have to be populated into an electronic list and linked to the location, the facility and department locations. We call these facility trees, right? And you get that,
Right.
And once you have that embedded into the software, then that's where you start to realize the efficiencies that Tony was talking about. That's where you start to get those gains. So that's the first thing. It's going to cost you some resources to get to the next level. The next one would be, Tony mentioned this as well. You have to have the hardware to go with the software. And so you need to have your mobile devices. I mean, one of the main efficiency gains is, allowing us to go mobile with the electronic system. And so you need to have make sure that you have the hardware in the hands of the people who are going to be doing the surveys, whether it's iPhone or Android, iPads, whatever it is, you need to have that ready. And along with the software and the wireless systems to go with that. So you have to have that infrastructure. So that's a necessary requirement. You also have to understand that once you've implemented your system, there's system maintenance. And that also is going to fall on the department. And that's related to the first things. You need to make sure that your contact lists are kept up to date when people come and go in the organization. That's something that is just necessary, so that your automated emails aren't going to a black box. Nobody's responding to it. And then same thing with when you add facilities, you've got to update the facility tree. And then finally, Tony mentioned this, and I mentioned it on my very last slide. For me, the main thing right now that I would say is a barrier to us going to the next level is ensuring that your environment of care rounding system is integrated with your work order system.
Right.
That is absolutely critical. We are at this point right now. Until we make that happen, and they're two different software systems for us. And it's good to know that up front. If you're planning on doing this, is going to, do you have to implement are you going to implement the facilities, rounding facilities maintenance piece with the environment of care rounding? Or do you already have a facilities building management systems that you're going to need to integrate? That's a really important thing to know up front, because if we're doing the plan, do, check, act loop, you know, that final action, if there's a manual data entry step at the end of all this automation, everything comes to a screeching halt. And that's unfortunately where we are right now. And so that's why that's our major goal for the next year to improve.
Yeah, and John, you make a really good point there, because you know, you invest in technology that's driving efficiencies, helping you do more with less, trying to maximize out your time. And it literally is that final piece of the equation that delivers all the goodness of all that effort that you've been putting forth. So that's a really good point. Tony or Lance, did you guys have any thoughts on that question as well, just surrounding the IT issues, and maybe any suggestions or recommendations as they make a transition?
I know. Go ahead, Lance.
Oh, no, I agree with what John was saying. And, you know, really, when you're going in and you're starting to implement that program, it's essential that you have your IT director hand in hand with you immediately. Because I've seen that happen. I've heard that happening at multiple facilities where they've got the software programs in place and they're ready to go. And then all of a sudden they got IT involved, and then they realized they had multiple issues. And then all of a sudden that project just went back 6 to 8 months to a year because they needed to add so many other aspects to it.
Yeah.
And I know it's, you know, it can be daunting on the front end of getting that escalation, like John talked about, making sure all that information's in there. But if you do it right, you do it once. And
You know, that is a really good point. Yeah, you're exactly right, Tony, on that. You do it one time and you're done. You're exactly right. Let me do this. So we have several more questions in here. Lance, I'm going to kick a question over to you, and then we have a couple more that we want to address. But so Lance, during surveys, and I'm curious about this as well, have you seen anyone who was successful with their EOC program that stopped doing tours?
You know, actually, the straight up answer is no. I had not seen anybody that stopped doing their EOC tours that was successful. And one specifically that I can think of is what they did. Instead of, they stopped their EOC tours, but they implemented in their orientation process. That's how they thought they were going to get the education piece. And what had happened is they realized that the staff were being fed so much information that day, they were just getting a minute aspect out of it. So when we actually got up to the floors, and they were talking about their EOC program, but when we actually got up to the floors, it was very evident that they didn't have an active EOC program. And, you know, we were starting to find findings right off the bat. So, you know, so at the end of that survey, it was we sat down and we did talk about some mitigation strategies, you know, for them because of that reason, because they thought they were approaching it in a manner that it was going to be effective for their facility, and it wasn't.
Right. Yeah, it's a really good point. So let me do this. There's actually two questions in the chat, and I kind of think they're related. We'll take them one at a time, and I'll just throw this out to anybody who would care to maybe provide some insight. Question is, we create quarterly survey tools and provide education. We struggle with accountability for managers to perform the tours, surveys, including fire drill critiques. How have you been able to gain buy-in for the accountability?
I'll jump in here. Go ahead, Tony.
Okay. I think every hospital struggles with this. Every hospital organization struggles with this because you want these people to be your partners. So there's an educational end of it that, you know, you have to be able to speak with them. I know in our organization, and John talked about this in his presentation, was the number of tours, a number of rounding and tours that happen on a unit, and is there overload within the organization, and people are getting so much. A nurse manager is getting beat up so much, or a director is getting beat up so much that there's a point for them that they say, how much more can I take? I know for us, and this was something I heard when we started doing rounding, we would do rounding and find a ceiling tile broken. And we would send that report to the nurse manager. And the one nurse manager who I love dearly looked at me one day and said, "What do you want me to do? Go to Home Depot and get ceiling tiles?" And so we as a group had to turn around and say, we have to change what we're doing and how we're sending our reports out, because that report for that broken ceiling tile or chipped ceiling tile shouldn't be going to the nurse manager. You have to look at how you're sending stuff out, because that nurse manager is going to look and go, what do you want me to do about that? That's not my problem. So
Right.
what we try to do with our reports, and I hope this is helpful to the person who's asking the question, is if there's something that is on a unit but needs to go to somebody else, make sure that that other group, whether it's biomed, whether it's environmental services, whether it's facilities, they're being alerted of that as well, and you're showing that you're assigning that to that group. Because otherwise you get this overload on that one person, and you're really setting them up to fail.
Right. That's a great point. And John, you were getting ready to chime in on that as well. What are your thoughts on that question?
Yeah, I agree with Tony. I mean, it's something that every organization faces, and there's, this could be a topic of a whole kind of webinar in itself.
Right.
But we've touched on it in a number of locations. I would say a few things. First, at the beginning in the rollout of your program, it is about that buy-in. And so I would say that in at least a good proportion of the cases where you're getting resistance, you may not have gotten full buy-in in the beginning from those folks. And so I would say you can ameliorate some of that pushback once you get into your program by doing more work on the front end with the buy-in and figuring out where those barriers are first. So that would be one thing. But then, even because kind of culture change is a never-ending kind of process, culture is always changing and people are always coming and going. It is a struggle, because we in the compliance realms, we're cost centers typically, right? And so that means we don't have hundreds of staff people around. And so that means it's harder for us to kind of get face time with people and help to do that education and that training and help explain the whys to all of these folks. But that is important, is to try to get, in front of folks in person as much as you can to help explain and find venues for doing that. So those are a couple of things that I would say about that. And then I agree 100% with Tony. Just make sure, if you can prove to people that you have built in all of the potential efficiencies that you can into the system, and you've married that with, this is a necessary process for us for safety and compliance of our organization, then you've shown them that you've done all you can do to help them help the organization. That also helps, I think. But if you are not thoughtful about it, kind of as Tony was indicating, you're given a list of 300 things every 2 weeks to a nurse manager, you're likely not going to get the results that you want. And I would say the final thing is, Tony also touched on this, is that if you have a fear-based culture, if you have a culture that's punitive, Lance touched on this as well, then people are, as soon as they hear the term environment of care rounding, they're running the other way. And so you've lost before you even started there. So you have to make it a positive experience. You have to make it about safety, about everybody, and make sure everybody understands the why.
Mike, can I add something to that as well?
Yeah, absolutely.
I really like what John just said about the fear-based culture. What I try to do and with our staff and when we do rounds is I say to the people, look, would you rather have us find it, or would you want to have Department of Health find it or Joint Commission find it? Because we're getting paid out of the same bucket as you. So we're just trying to, cut down on those issues that are found by the outside person. And if that usually helps, because then they look at it differently.
Yep.
Yeah, and I'll add one more thing to that. Sorry, Tony, that's a great point, is that if we can also show that we're listening, you can't come as a kind of the safety cop, so to speak. You have to come, I train all my team members that our MO is we're the collaborative problem solvers for safety and compliance. And you have to listen to them, because every organization is different. There's lots of differences, and there may be something that they teach us. We learn from our frontline people all the time that we need to modify our programs. And so if you can show people also that you're listening to them, and that you may even roll some of what they brought to you into goals for next year, that pays dividends.
Yeah, agreed with that. Lance, did you have any thoughts on that?
Yeah, no, I agree absolutely with what they're saying. They have there's multiple points that were absolutely correct from John and Tony. You know, and Tony started right off with this, and I do believe, you know, certain areas they are getting, you know, they already have alarm fatigue from alarms going off everywhere. You know, they also have tour fatigue as well, and so, you know, if you can make that process as efficient as possible, and then also, you know, I would do simple things as, you know, just bring up candy bars, just a stack of candy bars, something like that, that would come up when we do rounds, and they would disappear quickly. But staff was, you know, they were happy to have that. And then that started right into the process of, hey, we're here doing EOC rounds. That started that open communication. And then when we sent our reports out, you know, we focused on efficiency all the time. And when we sent the reports out, you know, the department heads wanted to see what was found in their departments, but with those reports came out, it was color coded. So it was immediately known by reading that report. You know, if it was something in the physical environment, it was facilities, it was already going to facilities, the work order was already, you know, put in, but that was found on, you know, in your area. So when I actually looked at the report, it would come down, maybe there were 3 or 4 things that was clinical education for their staff, which they could use in a huddle in the very next morning. So we tried to make that process as easy as possible for them.
Yeah, and it's a good point. And the only thing I would add to that, John, and you actually hit on it earlier, is just the importance of connecting your rounding tool to your work order system. Because if, you know, the nurse manager needs to understand everything that's happening in the department, but the responsibility flies or, you know, should be down in the facilities and in the work order system. And so awareness is good, but they're not necessarily their responsibility to manage that. Final question, and we're running out of time here. So very quickly on this. So how do organizations manage accountable persons during rounding when they have high levels of turnover and change?
That's a huge issue right now in healthcare. We're burning through
Yep.
people in healthcare. You really have to stay on top of it and be able to get, you know, have a way of basically when you get onto a unit, you have to make sure that the nurse manager is the same nurse manager and make sure those connections are right within the back end of your system. That's what we find because, like I said, we're chewing through people at this point in healthcare.
Right. Yeah, we hear that every day. And it's really hard to find great people to come back in. So anybody else have a comment on that piece?
I agree 100%. If you can find a way in your patient care services department, a central person, we actually have a list sent to us every month, of kind of the updated list of contacts. And then we compare that to our database for our rounding contacts. And then that's part of the maintenance that I was talking about earlier that you just have to do as the department that owns the system to keep that up to date. But it is absolutely harder in this day and age.
Yep. I'd agree. And let me ask just one final quick question here as we get ready to wrap this up. The question actually was interesting. It says, does budget have a place in our tour findings? For example, chipped Formica tops, things like that you find. How does budget come into play when you're actually doing your rounds?
Yeah, I actually I added that as a line item when I did my annual budget, specifically for rounds. And I would figure 10, just an extra 10% to go around, because that was the problem specifically with certain organizations was, in the physical environment, something had to be fixed in the department's area. It was going back to their budget. And that created a problem in itself, because people would get up there and they say, hey, I don't have that in my budget to fix that chip Formica top. So that's why I added that in specifically under rounding as a line item in my annual budget for that reason.
Yeah, so it's a tool for updating. It's a tool for risk management, for prioritization of where you want to put your money. I guess I was a little confused at the beginning about how do you put the budget in it, but it's definitely an information tool to help you to prioritize your risk management program, which then drives your budget.
Yep, agreed. All right. Well, hey, that concludes today's topic. I just want to thank Lance, Tony, John. Guys, thank you for your time. Thanks for being a part of the panel today. It was great information and a great Q&A, something that we could all benefit from. So we do have one more spring webinar coming up. Be sure to register for the May 12th webinar about the new emergency and water management standards. We're excited about our speakers for that one from Children's Health in Dallas and also CIHQ. Be sure to sign up. The registration's open, but that does fill up really quickly. So just a couple of reminders. One, everyone's going to receive an email to the link about future webinars. We encourage you to share this information with your colleagues and tell them about the webinars. You can also go to Soleran.com at Think Tank to check it out or watch other webinars that we've had. And there's probably 13 or 14 online right now. In closing, I just want to encourage everyone to use Facility Compliance Think Tank Q&A and the group on LinkedIn to get additional questions answered by our industry experts. If you're interested in any of the information or products that we talked about today during the video or at the beginning of the presentation, feel free to reach out to us by scanning the QR code that's here. We'd definitely be happy to connect and chat with anyone who has questions. Well, that concludes today's webinar. Soleran and our speakers would like to thank you for joining us, and we look forward to seeing you next time.